In Swahili, uzima is the word for wholeness. It's a concept that both describes Dr. Mark Jacobson's approach to providing healthcare in Tanzania and his career. He has spent almost the entirety of it in the country he first gave himself to 30 years ago. Dr. Jacobson didn't start out wanting to be a physician. Born and raised in Stillwater, Minnesota, he headed to Harvard to major in government and plan a career in politics. It was during a trip with his father to visit missionaries in East Africa that Mark Jacobson found his inspiration. He put the idea of politics aside, entering medical school at the University of Minnesota. After completing his residency, he received his master's in public health from Johns Hopkins University in Baltimore, where he met his wife, Linda. In 1982, the couple left for Africa. Dr. Jacobson first worked in Kenya, training community health workers. When he arrived in Tanzania 3 years later, it was as the sole worker at a small dispensary serving the Maasai and Waarusha populations. But he was already thinking big. Through his determination and leadership, that dispensary grew into Salien Lutheran Hospital. Through Salien, he took on regional health issues, including skeletal fluorosis, a condition that softens the bones of children where fluoride levels are high. He created one of the largest vesico-vaginal fistula repair programs in the world. He fostered AIDS care and education. He even created the country's first hospice program, making it a model of compassion for East Africa and beyond. After about 20 years of developing and expanding Salien's hospital, he realized that a second hospital, this time in Arusha, could do great good. He envisioned a facility that could serve the area's growing urban center and provide more specialized care for the population that had come to depend on Salien. So Dr. Jacobson planned. He raised funds, and he put in lots of long hours. In 2008, the doors finally opened. Today, the $10 million Arusha Lutheran Medical Center is a 150-bed hospital with 24 doctors and specialists and more than 130 nurses, and boasts multiple outpatient clinics, X-ray and lab facilities, an ICU, and 3 operating rooms. More than 94,000 patients were seen in the last year alone. It's no surprise that medical students and residents from across the world come to earn credit and find inspiration. And still at 60, Dr. Jacobson is hardly done. This fall, ALMC broke ground on the new Plaster House, a rehabilitation facility for children healing from orthopedic and other surgeries. A surgical residency program and a nursing college are on the horizon. Plus, Dr. Jacobson has been making plans to ensure that his mission will continue to flourish. There's been recognition to go with all the hard work. He's been named University of Minnesota Outstanding Alumnus, 3-time Rotary International Paul Harris Fellow, and the list doesn't stop there. Dr. Jacobson has also given of himself in other ways. He is a professor, international consultant, lecturer, researcher, and author, not to mention proud father and husband. But to Tanzanians, he's a part of what makes them physically and spiritually whole. His has been a full career, and a career characterized by uzima.
Well, good evening. It's really awesome to stand before you in the midst of the other honorees that are gathered here tonight and to reflect on 30 years of service in Tanzania. I have to tell you, this all begins with family and continues with family. For 30 years, I've been coming home and calling home, speaking with my mother, who's 93 now, and every time I've called her, she says to me, "Well, Mark, when are you coming home and being a real doctor?" The love and the desire of a mother for a doctor's son to be nearby, and yet her question really inspires us and allows us to understand something of the power of this award which you are bestowing tonight. To have one's peers and the leadership in the profession recognize and honor a calling which has taken one of our members far from the limelight into the distant lands of Tanzania is truly affirming, is truly honoring. It not only honors and affirms simply the work of one person, but it honors the best of what we seek to accomplish as physicians. As we heard earlier, that which has drawn us into the career of physicians, to be caregivers, to be those who love and serve those in need around us. This award not only honors those of us in Tanzania, but is reflected back to the membership of the AMA and the foundation for the work that you're doing to promote the very best of what medicine is about. It affirms for me a vision and a gift of sensitivity to the needs of those around us. It affirms the gift of reaching out and serving those who are most marginalized, those who are most desperate in the communities which surround us. It honors not only the individuals, but the teams which have made this possible. In no way is it possible to develop programs in AIDS and palliative care, hospital development as an individual, but as a team of Tanzanian colleagues, of American colleagues and friends, many of who have joined us tonight in honor of this award. It's really with truly in the profound sense of thanksgiving that I come before you this night to thank you for this award. On behalf of our colleagues that we have developed this work with in Tanzania, on behalf of my co-worker in life, my wife, Linda, and our 3 daughters, who as a family have undertaken so much of this together, to give thanks to the American Medical Association Foundation for making this award possible, to reflect on those parts of the world that are often not noticed or are forgotten. And so I want to thank you all, to thank God, and to say, God bless you, and thank you.